With that, I'm going to go ahead and introduce, just going to briefly introduce our community panelists and our clinicians who are joining us, but then they're going to share a little bit more about themselves. So joining us today, we have two members of the International Clinical Council on FOP. They're also the primary authors on the treatment guidelines, which we're discussing today. So Dr. Fred Kaplan, who is, I'm sure, a name you've all heard before, and Dr. Bob Pignolo. And then we also have two community members joining us to share their perspectives. So the goal of today's webinar is really not just for you all to understand, what the treatment guidelines are, but also we want to empower families to feel comfortable in having some ideas of how they can use this resource, this incredible resource, in their discussions with their local healthcare team. And so Nancy Sando, who is a founding member of the IFOPA, and Lara Theoret are joining us today to kind of lend their perspective in that area. So Dr. Kaplan, do you want to introduce yourself any further or share any welcome messages with our audience before we hand it over to Dr. Pignolo?
Oh, thank you, Hope. Thank you very much. And thank you for putting this very valuable session together. And hello to Nancy and Bob and Lara. And I'm very pleased to be with you. I'm Fred Kaplan. I'm at the University of Pennsylvania, and I've been involved with the FOP community for almost 40 years. So thank you for inviting me today.
Thank you, Dr. Kaplan. And Dr. Pignolo?
Yes, hi, everyone. Great to be here. Thanks for organizing this, Hope. I'm Bob Pignolo. I'm at the Mayo Clinic, and I also have been involved in FOP clinical care and research, not quite as long as Fred, but for certainly over 2 decades.
Great. Nancy, do you want to introduce yourself?
Sure. I'm Nancy Sando. I live in Petoskey, Michigan. I was diagnosed with FOP at 5, and I'm now 65. So I guess that's a little easy mathematics that I've had FOP for 60 years. I'm also one of the founding members of the IFOPA, so I've been involved with it since the get-go, and I'm very happy to be here.
Thank you, Nancy. And Lara, last but certainly not least.
Hi. So I live in the suburbs of Ottawa, Canada. Jaxon, my son, was diagnosed just after his 2nd birthday. He's now 15 years old. I've been involved in various roles within the Family Services Committee of the IFOPA and also involved with the Canadian FOP network. Jackson's first flare-up was after his 1-year immunizations, and he's been quite active with flares for the last 4 years, particularly in his hips, but elsewhere. So we've been using the guidelines quite a bit.
Well, as you heard, our 4 panelists obviously have done an immense amount of work and shared their time to contribute to supporting the FOP community. So before we start, I just want to say that I'm so appreciative to the 4 of you for taking time out of your day to join in this discussion and share with our audience and making sure that we can make this recording available for community members to access in years to come. And another big thank you before we get started to the International Clinical Council on FOP. So Dr. Kaplan is going to share more of an introduction to this group, but I just wanted to start by saying thank you so much to this incredible team of collaborators who've worked very closely with Dr. Kaplan and Dr. Pignolo to make the treatment guidelines accessible. And while the International Clinical Council is an organization that is, entirely separate from the IFOPA, we do value and appreciate so much the opportunities to collaborate with them on webinars like this, and also just for the incredible gift that they share to the community and the treatment guidelines. So Dr. Kaplan, I'll let you share a few words about sort of the history of the ICC and how it works to make this resource available.
Thank you very much, Hope. The ICC was founded in 2017, mainly because of the mission of the ICC is to really educate on the best practices for the care of individuals with FOP. And the ICC consists of 21 members, 21 clinician experts on FOP from around the world. These clinician experts take care of FOP patients. You know many of them. They represent 16 countries. We have 21 members. We have several emeritus members, but I think all told, our members represent 16 different countries from 6 different continents. There are many missions of the IFOPA, of the ICC rather, and one of the overriding missions is to publish the clinical guidelines. The clinical guidelines were actually published originally in 1995, and then in a formal sense in 2000, after the 2000 symposium on FOP in Philadelphia. And there was a consortium, basically the individuals who were involved with FOP at that time. The consortium put out 5 iterations of the clinical guidelines between 2000 and 2017. And then they were adopted in 2017 by the ICC, which had just formed, 21 clinical experts around the world. And the clinical guidelines took on a much more robust form after that. We published 3 iterations of the guidelines. And just published a third, just issued a third that's available on the ICC website and also the IFOPA website. It's available now. It was published in July of 2024, this year, so just 1 month, little over 1 month old. And it's basically an encyclopedia of FOP. It was written for doctors, for physicians, for caretakers, but it's also used by patients and families. And it's a very comprehensive and also awe-inspiring resource for the FOP community.
Yeah. So just to show the document. I'm sure you've all found your way to this webinar because you've either seen the treatment guidelines posted on the ICC or the IFOPA's website. But just for reference, this is sort of what this year's updated treatment guidelines looks like. So you can see this wonderful letter from Drs. Kaplan and Pignolo here, and then the front of the treatment guidelines, which has their information. And we're going to dive deeper into the table of contents in just a minute. But I wanted to go ahead and kind of jump into our discussion by talking a little bit about, Dr. Kaplan, you shared the history of the first couple of editions. Can you and Dr. Pignolo go a little bit more into detail about how you intended this document to be used first with healthcare professionals, because that is the sort of the target audience, right? This was not necessarily written for families. It is a resource for clinicians. So can you talk a little bit about how you intended them to be using it to help support their patients?
Sure. I'll start, and I think Bob will also comment. We talk about the FOP guidelines as a short term. It's called the FOP guidelines, but the title of it is the Medical Management of FOP Current Treatment Considerations. These are guidelines. These are not rules. These are not, this is not what you have to do. These are just guidelines. It gives people and physicians who are not familiar with FOP the framework of what FOP is all about. I think Bob and I and all the members of the ICC believe that not everybody, not every physician, not every clinician needs to become an expert on FOP, but they need to be aware that patients have FOP. And that's why we wrote this. We wrote this as a guide for them. And the actual medical treatment, medical prescriptions are absolutely individualized. And I think we absolutely want to emphasize that the care of FOP patients is individual. It's for each individual. And so these are just guidelines. I mentioned that the 21 members of the ICC who have written the guidelines are from 16 different nations, 16 different countries, and from 6 continents, and all of their contact information is in the back of the guidelines. And what we'd like to do is, I think the most important point that we want to mention is that every FOP patient in the world should have a primary care physician or clinical caretaker who understands FOP in its entirety. They should be in the medical profession, and they can reach out to any 21 of us and the consultants and the emeritus members as well. So the contact information is all listed in the back. Again, we don't want physicians to necessarily become experts in FOP. We're the experts on FOP. We need generals on the ground to assess what's going on with individuals, and not every problem that someone with FOP has is an FOP problem. And that's important to know as well. And so it's important that the primary care physician and the experts have a dialogue with the patients and the families about this. And that's how we want this to use. We want this to as a basis for creating a community of awareness about the health of individuals with FOP.
Yeah, I absolutely agree with all of that. I think, you know, I think the intention is really to use the guidelines in 2 major ways. One is really to introduce primary care physicians to FOP. Not infrequently, we'll get emails or calls from physicians asking specific questions about FOP as well. So in those 2 settings, the guidelines, I mean, we certainly, we certainly answer the question that is being posed, but we also will give the management guidelines as a reference. So the first big category really is someone who's taking care of a patient with FOP, usually in the primary care setting, but not always. We'll get questions from specialists about FOP, and we'll answer their question, and then we'll give them the guidelines, and we'll specifically refer them to a specific section of the guidelines. The second big way that I think these guidelines were meant to be used is for patients to advocate for their proper care, and so not to take the role of the physician away from them, but to make them aware that experts from around the world have addressed a lot of the common questions and how to manage a lot of common problems that are unique to FOP. So we have this as a reference, and we have this as a tool for patients to advocate for their own care.
And we also think this is a very good document for insurance companies as well. They think, oh, FOP, what is FOP? And they become aware that there's a community, a medical community, that's very well aware of the problems that FOP patients have, and they better pay attention to that.
Yeah, and I know outside of the hospital and the insurance companies, like you mentioned, Dr. Kaplan, there are a variety of different settings that our families are needing to use this resource in. And Lara and Nancy, I'd love to turn to you to hear a little bit more, as we have primarily families logging in to listen to our conversation today, from a family member, how you've used the guidelines. And Lara, maybe we'll start with you, because I know that Jaxon has so many areas of life that he's really engaged in, and you've had a broad network of support that you've had to make sure is connected and knowledgeable about FOP. So can you talk about how you started using the treatment guidelines with your care team? Oh, I think we have you on mute, Lara.
Sorry, I muted myself. I have a noisy family here, so yeah. So I mean, in the early days, I printed it, but now we just send an email link with a link to the the updated guidelines, and I remind them when they become updated. In the early days, we didn't have great, really sort of knowledgeable doctors. We had a community pediatrician, and he did take an interest, but he would generally just sort of assess from a purely physician standpoint, and then turn to me and say, "So what do we do?" from the FOP standpoint. And I would use the guidelines and contact Fred if I needed, sorry, if I needed more assistance. But, it was generally just, he had a sprain. Okay, let's look at the guidelines. What is the dosing recommendation for prednisone? We also have used it at the pharmacy. Sometimes they, especially when he was younger, and he was quite young, and it's quite a high dose of prednisone. We would get some pretty astonished responses from the pharmacist, and they'd say, "Oh, I haven't filled it yet. I'm just waiting to hear back about the doctor. I think there was a mistake on the dosing." And I pull up the guidelines and say, "Actually, that's the recommended dosing. You can find it right here."
And we talked about sort of an acid test, or using the guidelines as a resource for you as families to be able to also kind of realize if the doctor you're working with is someone who's maybe going to be compatible with your needs moving forward. And, if you've given them the guidelines and maybe the executive summary, which Dr. Kaplan, Dr. Pignolo are going to go more into detail as we talk about the different sections here in a minute, but that's a really great way for them to get sort of like a bird's level view or bird's eye view of everything they need to know from a general stance. And if they haven't read that executive summary by maybe the next time you go to see them, then like that might be a good test. Like, are they a doctor who's going to be invested in learning about your needs and caring for you or your loved one with FOP to the level that I know a lot of our families are looking for. So thank you, Lara. And I know that Jaxon has gone to a lot of different specialists, or that, he was very engaged with different supports at school or different extracurricular activities. Did you use the treatment guidelines in those circumstances? And in what way or degree did you kind of share them with people outside of maybe your primary provider?
Yeah, absolutely. Yeah, he was involved with physiotherapy at a very young age, actually before we were diagnosed. But after we were diagnosed, we made sure that the physiotherapists looked at the guidelines for treatment so that they were aware of the risks there. So that was one big point. The school, not so much. They're not getting into the medical side, but physiotherapy was a really important role to be aware of the risks.
Yeah. Thank you. And Nancy, you've, from a community family perspective, you might have been using the treatment guidelines the longest from many of the families that I've had a chance to interact with. So do you want to share a little bit about how you've used them and how that sort of evolved over time, or when you found them particularly useful in different experiences you've had throughout your life with FOP?
Yeah, I can think of a couple different instances. One, my late husband, Andy, who also had FOP, we were looking for a new doctor because our old one relocated. But anyway, we walked into this one doctor's office and had one of the supplements of the guidelines, and we gave it to the doctor, and he goes, "Oh, I remember seeing something like this. I was on my treadmill and I didn't think I'd ever seen anybody with FOP, so I didn't read it. Well, I'm going to go back and read it now." And he has been a truly valuable doctor ever since that time. He's even talked with Dr. Kaplan on a couple of occasions when I've had flare-ups, when he's been a little like astounded because he'd never seen a flare-up before. So that is one way. Again, he is a doctor I've had for over 30 years now, and I would stress very much so that a doctor that you're connected with is willing to consult with others, whether it be the guidelines or one of the ICC members, because if they don't want to connect with other doctors, then that's not a doctor for an FOP patient. I think we need to stress that a lot because we have different needs. And there are different phases to our lives that we need maybe specialists and things like that. And it's very nice that it's on the internet now where we can just download it. They've done that in ER on occasions when I've well, recently broken a leg or two. So they know what to do and what not to do. Along with one of my last hospitalizations, which was just in July. The hospitals, I think, around a lot of different areas are going to hospitalists now, where there's a doctor that's in charge of a certain amount of patients in the hospital, but you don't see your own primary or specialist per se. And I had the situation develop that I was in for pulmonary problems, and we pulled up the guidelines, and he did read them, and I think he even talked with you, Dr. Kaplan, because of my respiratory situation was on the not severe side, but it was challenging to this doctor because he had no clue what FOP was, and he wasn't necessarily taking my word for it on how to treat and what to do and what not to do, especially in my care level of positioning in bed and comfort measures and things like that. So the guidelines became very valuable during that hospitalization. And so he wasn't my primary, but he was the one who was, you know, doing all the shots of well, we want to do this test and this test. Well, should we do this test? You know, so it made it very valuable for him to see something so organized and so valuable to a tool for him to use.
Yeah, and it's a great perspective to hear. You know, Dr. Kaplan, you kind of started by saying we're not trying to turn your local healthcare providers into FOP experts. We still want them to reach out to us. And I think what I've heard from Lara and Nancy is that, you know, from the family perspective, finding a doctor who's willing to do that is sort of the first work or task you're set out when you're trying to really find that perfect relationship to use this resource, the treatment guidelines, to its fullest. So it was great to hear both of your perspectives on that. But another thing that I'd love to hear from you both on, Lara and Nancy, is so you found this doctor who's willing to work with an FOP expert and willing to read this treatment guideline. What did you yourselves do in order to be able to feel comfortable referencing them, right? Because I think a lot of times the patients are reading them, or the family's reading them. And did you just immediately like soak it all in and feel like, I'm going to go to my doctor and here's what I'm going to tell him? Or was there sort of a process or steps or resources you used as you were making sense yourselves of the treatment guidelines? Because they are written primarily for the medical audience. Lara, do you want to start us off?
Sure. Yeah. Well, in the early days, Jaxon was young and I still had a little bit of time to do things. And I immediately read it from front to back, admittedly over a period of time, not in one sitting. There was quite a bit of medical jargon that I wasn't familiar with, so I would stop and look up words, and I started creating a little glossary, but now the IFOPA has provided a glossary, so you can use that to speed up the process. But yeah, I just read it from front to back because I really wanted to understand fully, you know, all the risks, all the concerns, and make sure that I was on top of his care. And now I just try and skim through and look for what's changed, the updates, the new sections, any changes to, you know, things that look different. So.
And Dr. Kaplan, I know you had mentioned that the treatment guidelines, the document is sort of set up to help different people at different times in their lives. Do you want to expound a little bit on how the sections you feel like are intended to serve what's relevant to children or adults? Or
Yes, I think that very often after a child is diagnosed, they're referred to a clinical expert in FOP somewhere around the world. And that person that expert is very, very attuned to giving the families the knowledge of FOP and what they need right then. I think we certainly don't want to throw everything at them. My wife is a pediatrician, and she brought home, she contributed, she's a gastroenterologist, and she contributed to pediatric textbooks. I could barely carry them. I mean, each one weighed 10 pounds. I think there were 2 volumes. And certainly when a healthy child is born, nobody gives the parents a 20-pound set of books to read. So the clinical guidelines are not for newly diagnosed patients. They have information in them that can be used, but we all know that every patient is different. Even I mean, I've seen 3 pairs of identical twins in the world, and even the identical twins with FOP are different. So there's no one size fits all. You know, the guidelines can be used at various times in life to support the clinical care of FOP patients, and I think physicians are well attuned to looking what they need to know, and they clearly can contact us, to the experts on FOP, to assess that.
Yeah. And Nancy, do you want to share anything about your process of becoming more comfortable and more familiar with the guidelines so that you felt confident using them?
Well, as Dr. Kaplan has said, the guidelines can be kind of as heavy as encyclopedias. And I think we all have to take that to heart. And I think it's a good practice, well, at least for me, because the IFOPA was created in my late 20s, so I didn't have a lot of information when I was younger, but now there is this document, which is wonderful. But I kind of choose to look through it, just kind of brief through it to see the changes, if they pertain to me as a veteran, I guess you could say, along with the table of contents, of course, is very valuable too, because you can just, if you're having respiratory problems, go to that kind of page, or the prednisone guidelines that's been used. And I had the same situation that Laura did with my doctor's nurse, who had no knowledge about FOP, and I said, I'm having a flare-up, and my doctor called in a script of, the prednisone, and it, the high dose, and she goes, we don't prescribe that high. I'm like, just please let my doctor know that this is going on and whatnot. She called 10 minutes later and said, your prescription is being called in right now. So, there are those guidelines, because my long-term doctor knows about flare-ups, knows Dr. Kaplan, and we do choose to follow those things and those steps. And again, I can't press hard enough to have that long-term doctor available to you, even over the phone, because I didn't have to go in for that flare-up. He just knew that I knew what I was talking about. He called in the script, and a few days later, I was very much relieved from some of the complications of a flare-up.
So I wanted to go back for more of a visual aid as we're sort of discussing some of the next few topics. And I think the first one that we wanted to make sure that was addressed was related to the translation of the treatment guidelines. So I know that the ICC and Drs. Kaplan and Pignolo wanted to make a very clear statement to the community about translating the treatment guidelines. And Dr. Kaplan, do you kind of want to go into any explanation or review of this with the community?
Yes, thanks, Hope. I think it's very valuable to read this in English, of course. This version of the guidelines, the new one that we put out, as all of them, are written in English, and which is the main medical language of physicians around the world. And it's the only version reviewed and endorsed by the ICC. And the reason for that is that the treatment guidelines contains medical information. These are guidelines, as I said, they're not rules, but they have doses for medications, and they have specific things that should and should not be done. And if they're not translated properly, it might give erroneous information that could be harmful to patients, and that's what we're concerned about. We're concerned about safety, and so we say in this statement that the ICC acknowledges that this document may be freely translated into other languages, but does not guarantee the accuracy of any such translations, mainly because we don't know those languages. There are many hundreds of languages around the world, and to the extent possible, any translations of the FOP guidelines should be performed and reviewed by bilingual medical experts from the country or the language where the translation is intended to be used. So we feel pretty strongly about that. And again, it's a matter of safety. It's not a matter of convenience. It's a matter of safety.
Thank you, Fred. Yeah, I know I get that question from international community members. And it is hard because there are tools out there that help people translate documents like this, but knowing that it's really important that that's not a safe method to access it, but you really do need to be working with medical professionals. So
that's right. And if there's a comma missing or something, it may change the whole flavor of the treatment recommendations.
And so something that's been touched on at several different points so far, we brought up the executive summary, and Nancy was referencing different sections within the treatment guidelines, that it is really well organized to be accessible in a way for someone, whether it's a family member or a clinician, to be able to look at this very large document with many pages and quickly be able to go to one section where they can find out specifically what information they're looking for. So Drs. Kaplan and Dr. Pignolo, we're going to kind of take us through an overview of the 7 main sections that are included in the treatment guidelines. And I'm going to go ahead and launch a poll. So we would love for anyone who is listening in to go ahead and let us know, when you have had conversations with your doctor about using the treatment guidelines. So what are the common questions that they have that are coming up about navigating this resource? So if everyone wants to take, I'll leave that open and let people kind of submit some answers to that. But Dr. Kaplan and Dr. Pignolo, if you guys want to get started, I'll close the poll and we'll kind of display feedback once we get some answers. So.
Okay, thanks. Thanks, Hope. There are 12 major sections to the guidelines, 12 major chapters to the guidelines, but I want to bring your attention to one of the first and one of the last. One of the first is and you mentioned this before, the executive summary of key practice points. The guidelines is almost 160 pages long, but the key practice is the executive summary of the key practices. For FOP is only 6 pages. And like you said, or Nancy said, if your primary doctor does not read those 6 pages at your next visit, then that's not the doctor for you. So that's not the doctor for FOP. So it's very, very important. It really summarized in those 6 pages. It's not everything, but it summarizes the key clinical points. And it starts with an introduction to how we came up with those key clinical points and how among the 21 experts in FOP, how we decided what should be included in those key clinical points. The other section I'd like to bring your attention to is towards the end of the document, and that's the emergency guidelines for first responders. It's not just physicians, it is physicians, but it's not just for physicians. It's for first responders, being physicians, dentists, and other emergency personnel. Those are very, very important. And some of those are summarized on bracelets, etc. But those are key clinical points when it comes to an emergency for FOP. So those are two sections that may be very valuable. The three major sections of the guidelines, three large sections of the guidelines, can be summarized as the basic science and basic principles of FOP in the first section. The second section, known as section 4, is all the medications and the rationale for use of those medications at various times and various circumstances for FOP. And the third major section, section 5, is special medical considerations in FOP. And that has basically come from the community as well. Basically, what problems you have and you want addressed. And there are 38 sections in there, and there are many, many new sections in the guidelines. I can emphasize, and I know Bob can too, that almost not every, but almost every section of the guidelines has been revised. Every subsection of the guidelines has been revised, but there are major new sections and major changes in old sections, and they are over 20. For example, the executive summary has been changed in this iteration. Developmental biology of great toe malformations in FOP. We learn why the toe is malformed in FOP. So that's in the first section. The off-label use of potent medications for managing inflammation in FOP. That's a new section. Clinical trial results. That's a new section. Immunizations and COVID guidelines have been updated. Developmental arthropathy, arthritis, and degenerative joint disease in FOP has been revised. Ingrown toenails in FOP, a common problem that we learned about. We address that in this iteration of the guidelines. There's a major new paper that the ICC put out on fracture care in FOP, and we incorporated those suggestions and dialogue into the guidelines as well. So there's a section on fractures in FOP. There's a very, very important section on nutrition, calcium, and vitamin D guidelines in FOP. Prevention of oral health in FOP. One of the most common questions that we get is related to the teeth and the dental problems in FOP patients. And there's several sections on that. There's prevention of oral health issues in FOP, written primarily by Dr. Clive Friedman, who's a member of the ICC. Extraction of wisdom teeth is a new section. Swallowing issues in FOP, a new section in the guidelines. Women health in FOP, very new section, again, from our community that wanted that section in the guidelines, and we agreed that should be addressed. Gastrointestinal issues in FOP. Not all these questions have been answered, but these are issues that are brought to the forefront in these guidelines. Pregnancy issues in FOP, that has been revised in a major way. Impact of FOP patients on families, that has been added to the guidelines as well. Unmet needs in FOP, classes of medications, and Bob can address that. Emergency guidelines have been updated. And then, of course, our disclosures, author contact information has been updated, and the targets and potential treatments figure in FOP has been updated as well. So these are not minor revisions, these are major revisions. And I would say, don't use the old guidelines, use the new guidelines, because even if they're minor revisions, they may be important. Those important revisions have all been addressed and addressed in the key practice points that are in the front of the guidelines as well. So those are the major sections. The two that I think will be very useful are the key practice points and the emergency use, emergency care. And then the three sections: the basic science of FOP, the medications for FOP that are rapidly evolving, and the individual sections that can be assessed as needed by patients and physicians.
I
Yeah, I think
appreciate.
oh,
Go ahead, Bob.
I think outside the two major sections, the executive summary and the emergency guidelines, most physicians will probably get the answer to their questions in section 5 or the tables at the end of the document regarding how to prescribe the medications that we um, uh, often think are either theoretically helpful or that we use mostly for pain control and in the setting of flare-ups. So I noticed there's a question in there's one question in the question and answer, and I'll just quickly answer that because it's related to the tables at the end of the document. And so the question is related to Montelukast. Paulo, Dr. Rocco was correct. We don't use montelukast as an acute treatment for flare-ups. We use that as a chronic treatment. That is a long-term treatment to hopefully quench the likelihood that one might get a flare-up. So the other general comment I wanted to make, and we get this question a lot, is what should physicians and patients do in between the time that the guidelines are updated, and we try to do it roughly every 2 years or so. And the answer to the question is when there's new information available, when there's new evidence available, or when there's something that's going on that has direct implication for FOP, the ICC will write a short statement, and we'll put it on our website. So we did that multiple times for information regarding COVID-19 and vaccination. We did it more recently for the use of certain repurposed drugs. And so Fred and I especially, we keep a rolling list, if you will, of topics that we want to address in the next version of the guideline and updates that we want to make. But in between, check the ICC website because we do hear questions that arise in the community, and when we think there's a critical mass of evidence that suggests we should change something that we put in the last version of the guidelines, but may be evolving quick enough that we need to say something before the next version of the guidelines.
One of the things that I think is very exciting in the FOP community is we're in a phase now where there's rapid evolution of knowledge, and that's because the FOP gene was discovered, the target and the pathway for drug development has been discovered with that FOP gene. So genes make proteins, and they're not just part of they're not just they don't just act independently, but they act as part of a pathway, and those are all targetable. There are many different clinical trials that are going on around the world, and I know it's kind of dizzying and confusing for FOP families, but hopefully in the next couple of years we'll get some clarity on these issues, and these will be incorporated into the treatment and of course into the guidelines for FOP. I will also mention that, and as I said, this is a new section of the guidelines, the clinical trial results. all of the guidelines, both the basic science and the medications, and also obviously the individual subjects that are addressed in the medical considerations in FOP in the major part of the guidelines. They're all very well referenced, and obviously doctors and patients and families are not going to read all those references, but those references are given. And so if an individual wants to, they can reach out to those references and look at those references. And if you don't have them, perhaps we can, they're not accessible to you as patients. We can provide those. We often do.
Because many of them, I think, are in scientific journals. So if you haven't tried to look up an article yet, sometimes they're locked because you have to have a subscription to different medical journals. So that's very kind, Dr. Kaplan, to offer to help families access those resources. And I held this slide up on the screen. I wanted to make sure that we came back to it because several of the responses that came in through the poll, and also I've seen it come up in chat, Lara had mentioned it, were around the topic of the dosing of prednisone with their provider. So that's something that people seem to get a lot of questions, potentially even pushback from, whether it's their pharmacist or their primary care provider. So I just wanted to make sure to highlight this this one snippet of these class of medication tables that they have. And I don't know, Dr. Pignolo or Dr. Kaplan, do you want to kind of walk us through how this is laid out to help healthcare providers be able to get some sense and direction on dosing for prednisone?
Yeah, I think most primary care doctors are familiar with steroids, and they're within their purview. They use it in conditions that require much lower doses, and so the key column here is the dosing column, and I think right up front we say what the doses is and how to use it, and so of course I think as good a medication it is for symptom relief, it really doesn't alter the end result of a flare up, except in maybe less than 20% of probably closer to 10 or 15% of the time. And of course with prednisone there are major side effects, and so for example, if you're an FOP patient with diabetes, taking these high doses is also going to require an adjustment in glucose control over that period of time when the medication is being taken. That should, every card carrying physician should be able to know what I just said. But the key, as you mentioned at the start of this conversation, the key is if you need to provide documentation to a physician to convince them that the doses are what the doses are, this is where you go to. You go to table 1, class 1 medications right here. This is where you go. But in general, we for medications that are not as commonly used, primary care doctors might be interested in how the drug works, that really establishes the rationale for its use, and of course what the side effect profile might look like.
Thank you, Bob. And we just had a question come in about assistive devices. So I also wanted to make sure to just highlight this in the table of contents, because Dr. Kaplan highlighted all of the newer sections, but this one, because we have some incredible champions for assistive devices in the community, I believe has been a part for a while. And I just wanted to make sure that families knew that this is a great section. If you're just looking, at very specific pages within the guidelines, you don't want to read the whole thing. This is a really great section to print off and bring to maybe your school, because a lot of families do have IEPs or 504 plans here in the US, we call them, where you know, the teachers or the team at your school is looking at what sort of accommodations have been recommended for people with this condition. And so that can be a really great section for families to print off and use in a school setting or outside of maybe the medical realm that we've been discussing primarily today. So, yeah. Well, I want to thank everyone for this overview. I think we have just under 10 minutes left. So Dr. Kaplan or Pignolo or Nancy or Laura, feel free to interrupt me. But I wanted to just highlight a few resources for folks to be aware of. Something Lara mentioned is a glossary, and she started her own glossary of terms, which I think is an incredible initiative, Lara, and just goes to show what an incredible advocate you've been for Jaxon throughout his journey. But she was kind enough to share her dictionary with us, and the IFOPA has looked at different words that come up in you know, publications that are released or that come up in different news articles related to FOP. And so we've created this glossary of terms, and it's interactive. So you can click on a word and that word will pop up with a definition. And if that definition has other terms than maybe more of a scientific jargon, those terms will also be linked in the definition so that you can try to get a fuller understanding or a better understanding of some of the terminology that you may see used in the treatment guidelines. So that was one thing I wanted to make sure to mention. Another resource that we have done, and we do this in close collaboration with the ICC, is that we've taken different sections of the treatment guidelines. So the oral healthcare section, which Dr. Kaplan mentioned earlier, we have been working with Dr. Clive Friedman, who's an oral health expert, to create a handout that's really geared towards families that focuses on the information that's in the treatment guidelines. What are the practices and recommendations that are in this oral healthcare section? And we're trying to put it in a more digestible, visually appealing format for families to use in every day-to-day life, or even in conjunction with the treatment guidelines when you're working with your local healthcare providers. So just to make sure, if you haven't found the homes for where these documents live, I wanted to point out that the ICC does have a website, iccfop.org, and you can navigate on the toolbar on the left or use this shortcut to access the latest treatment guidelines. The IFOPA also houses this information on our website as well. If you click on this red emergency medical treatment information that is at the toolbar at the top of our screen at all times, it'll take you to this page where you can see not only the treatment guidelines, which we've been discussing in depth today, including that emergency guideline for first responders that Dr. Kaplan mentioned, but also the periodic updates that come between the re-release of the treatment guidelines. So Dr. Pignolo mentioned there was an off-label medication statement that was released earlier this year. So we have those publications or statements on the website as well. So those were the main points that I wanted to cover sort of in closing. But Dr. Kaplan or Dr. Pignolo, I know our conversation has been winding and we've covered a lot of different aspects of using and sharing the treatment guidelines as a resource, but is there anything you'd like to share in closing?
So I'll make one comment, and it's related to the second question that's in the question and answer. You know, FOP is an ultra rare disease, and sometimes we just don't know when a specialist, for example, is advocating for some new treatment, whether or not it's going to work in FOP or whether or not it's safe in FOP. And so, in the question posed in the Q&A, it's a question involving an assistive coughing device. And sometimes we can try to answer questions by what we know empirically. So, for example, patients with FOP are often put on CPAP devices for respiratory conditions, but the guidelines don't often include every new or potential intervention that is done for the same condition in patients without FOP. And so sometimes we just don't know the answer. And sometimes the safest advice that we can give is really to do a short trial on something that is clearly not invasive, and clearly has a good, excuse me, a good risk benefit, or at least a risk benefit that favors benefit. So I don't have a direct answer to the question posed in the Q&A regarding the coughing device. I'm not familiar with it. However, patients with FOP can tolerate things like CPAP or BiPAP, and so again, with not definitive knowledge about that, it doesn't appear to be too invasive. A short trial may be appropriate, but you're not going to find that sort of information in the guidelines. There just aren't enough people with FOP who've tried every one of these interventions that may be trialed in someone without FOP.
Thank you. That was a great answer to that question, Dr. Pignolo. And thank you for all those who've submitted their appreciation in the Q&A and in the chat. We understand that you also have many demands on your day, so we appreciate you taking time to be a part of this conversation. And I've loved seeing all of the encouragement between participants or attendees taking place in the chat as well. So we will have a recording of this presentation or discussion available on the IFOPA's YouTube channel by the middle of this week. So please do keep an eye out for that. An email will go out to attendees to ask them or to direct them to that, and also ask them to take a quick survey to share their feedback on today's panel. So with that, I do just want to share, there was one question that came in and I answered it. So Dr. Pignolo, you might not have seen it, but someone was asking about vaccines. And so I wanted to make sure to let everyone know that in conjunction with Dr. Chris Scott, who is a member of the International Clinical Council on FOP, you may have seen his photo on the slide previously, we'll be doing a webinar on September 19th, so later this month, on the topic of vaccinations and FOP. So that will be a great place to go. We'll be doing exactly what I mentioned earlier, going a little bit more into detail on that section of the treatment guidelines, where Dr. Scott will be adding a little more clarification catered towards the family audience, and we'll be able to answer more questions along that topic there. So for everyone who joined, thank you so much for being a part. And to our panelists, of course, Nancy and Lara and Dr. Kaplan and Dr. Pignolo, you know, I can never express enough my gratitude for what you do to help support the FOP community and the IFOPA. So thank you so much. And I hope everyone has a great day.
Our pleasure.
Yeah, thanks.
Absolutely. Thank you, Hope.
Thanks, Hope.
Thanks, everybody.
I'm hoping that
Nancy,
it
Lara.
needs some information.
Yes. Thanks, everyone. Take care. Bye.